All right. Well, welcome everyone. Looks like we have a good crowd today. I'm Carolyn Scott McKay. I'm with the Center for Applied Research Solutions. We're one of the, in conjunction with Cognito, we're one of the partners in terms of providing technical assistance and training support to the CCC system in terms of the Student Mental Health Project and Initiative. And I have two co-presenters with me today, Erica Green, who is a consultant with CARS, but also is with People Reaching Out, which is a community-based organization. And then also Dr. Al Stein-Sarosi from the Pacific Institute for Research and Evaluation, and he is part of the evaluation team for the CCC SMHP initiative. And so I'm going to be taking the lead today for the most part and facilitating our discussion, but Al and Erica are going to be stepping in terms of portions. And so our goal today, our main purpose is to start to have some dialogue with you about strategies to assess student mental health needs for your campuses. And this was something that, as we were doing the initial consultation and readiness calls with the campus-based grants, as well as the broader CCC campuses, that we started to hear some need around. And we know that as for your campus-based grant initiatives, you have some short-term or more immediate needs around conducting an assessment process around student mental health needs. But we're also today hoping to start to just start thinking about it from a long-term perspective as well. That, why conducting an assessment is valuable for not only for the grant initiative itself, but just having a system in place long-term that you're collecting data to inform your planning process, as well as building capacity and increasing awareness and support. And we're going to be thinking about it from the short-term perspective in terms of your grants, but also hopefully starting to think about it from a longer-term perspective in terms of having some assessment tools or processes in place for your campuses. So in terms of our agenda today, we're going to spend a little bit of time on the front end, just briefly, just thinking about the question, why? Why is it worth our time to start to collect data and invest in the data collection for an assessment? And then we're going to transition the conversation to starting to talk about what are some of the things that you should be thinking about in determining your assessment approach. What are some of the questions to be answering? What are some of the thoughts? And hopefully start to be kind of putting things into perspective. And then we're going to get a little bit more concrete about it and actually start to look at some assessment tools. We're going to look at the common standardized student surveys, and as and the student survey for the campus-based grants is predetermined, but we're also going to be looking at some other customized tools that might work to supplement that information or might be of value. And then we're going to try to wrap the conversation up by thinking about, okay, if we invest our time in collecting data, we have the data, we have the findings, what are we going to do with it? How are we going to maximize these findings and build it into our long-term planning processes for student mental health on our campuses? So that's the lineup for the day, or for our hour and a half together. And we're going to start with the why, in terms of what is the value of doing an assessment. So it first helps us to understand the student mental health needs on the campuses, maybe and provides the data to actually support it. We may, you may have a general understanding of it, but maybe not are you may or may not be surprised in terms of the data. It may support your understanding of it, or it may lend to your understanding of it. And the data also will provide information related to unique student and or campus issues or needs for your particular campus. So are there particular student populations that are not accessing services or some disparities that are unique to your campus? Are there some, to what extent do your faculty and your staff have an understanding of the student mental health issues, and how comfortable do they feel or not feel in identifying or referring students or addressing issues with students as appropriate? The data can also provide a basis for capacity building. So where are your faculty and staff in terms of their awareness, comfort levels, and current capacity, and are you in a position to be able to address that or do anything about it? It will also assist in, assessment always, when done correctly, leads right back into your planning processes and your implementation processes. So hopefully it will feed right back into those systems for you. And then ideally, at times, if you're strategic about it, when you're collecting assessment data, it can actually serve dual purposes. It can also act as baseline data for future evaluation efforts. It gives you a baseline reference in terms of where you're at, in terms of these areas of interest. And then if you decide later that you're going to actually try to make an impact on these areas, it can serve as a baseline for looking at change over time later on. And so whenever thinking about what data you're going to collect, it's useful on the front end to be thinking about what the questions are, what you're going to use it for, and what purpose it'll serve. And that usually helps to define the actual information that you're going to collect. So here's just a visual in terms of thinking about assessment as part of your ongoing planning process and implementation process. So assessment, first, it really is kind of a first step, kind of assessing the lay of the land. And then it links directly in terms of building capacity. So you identify the needs, you identify the issues, you identify service gaps, you identify areas where capacity needs to be built. And then it should hopefully link directly to the capacity building efforts themselves, as well as whatever your implementation or service plans are, and that could also relate back to kind of systems and infrastructures. Maybe the information that you're going to collect regarding your current services or capacity might relate back to policy and some infrastructure changes that you're hoping to make. And then, hopefully it relates back to any evaluation efforts or feeds kind of in a circular process with any evaluation data that you'd be collecting. What's missing from this picture is, I think, in the center, what all of these processes tend to lend themselves to is sustainability. So the assessment process can give you the data to document, advocate for, justify the importance of student mental health for your campus and the need for it, and hopefully be part of your long-term sustainability efforts. In terms of making the results work for you, so again, if you're going to take the time and invest money and resources when the resources are limited to begin with and your time is limited, and there's a certain amount of actual, financial resources that'll go into it, how do you maximize the results to make sure that they're going to achieve what you're hoping to achieve? I think part of it is just being clear on the front end too, in terms of what what the data, if you're collecting the information, how is it going to be used, for what purposes, and who will it be shared with? But in terms of thinking about this effort, I think the reasons for doing the assessment are kind of threefold. One is to build capacity, create a plan to distribute your results, have it be part of your regional strategizing forums, have it tie back to that, have it tie back to or feedback into your, back to your administration, back to your faculty and staff, back to both your on-campus and off-campus partners, and also to, again, assess your training needs or your capacity needs that you may need to be addressing as part of your grant or your initiative. But again, if we're thinking long-term, you can easily, you can think about what you need for the purposes of your grant, but hopefully there'll also be a thought around, what data or what assessment information would be useful to be collecting on a somewhat regular basis to support the student mental health efforts on your campus. So building capacity is one area. Another major area, and this we were hearing pretty clearly from the calls that were conducted with the campus-based grants and the other campuses, but to have some data in hand to be able to increase the awareness among faculty and staff regarding the need, but also to promote it to administration and to have something in hand, data in hand, to be able to support the case why student mental health services, capacity building, and support in general is important and why it's needed. So this was an area that we kind of heard pretty clearly. And then the program planning part, how does it feed back into your actual planning, whether it be services or what's the point that's missing from this slide is also whether it feeds back into your policy work or your systems or infrastructures that you're trying to build. Does it support a case by collecting data? If you're in a place where you're hoping to create some type of behavioral assessment team or intervention team, does this help support the need for that on your campus? Are you collecting information that you need to support that? Or do you need better policies and procedures on your campus, better referral systems? Is this the information that you're collecting, is it going to help to lead into that process for you? But also just in terms of services, hopefully it could assess gaps in services, barriers in service, or specific service needs. And you can think about that broadly in terms of the overall student population, or more specifically, are there certain student groups that are not accessing the services the way they should or could, and or are there particular student populations where there's some disparities that are happening? So those are the areas that we thought of in terms of and what we heard when we were doing our calls: the building capacity, increasing awareness and support, program service, and planning. We're going to do just a quick poll just to get make the session a little bit more interactive and have some opportunity to kind of hear that you can kind of hear from one another. And so I think Joanne's just going to lead us in a polling question, which will just if you were to define your primary goal of doing an assessment, what would it be in those areas? Or is it pretty much all of the above? And Joanne, it looks like people are starting to answer. Maybe I don't know if there's anything else. And so we can actually see the results coming in, which is kind of cool. And Joanne, can they see that as well? Or is it just for our viewing?
I believe they should see it. I think it's supposed to share it with everybody.
This is Al. I can see it.
Okay. All right. So it looks like For most folks, they're saying, yes, we identify that all these areas do have some relevance and that we're interested in collecting information for these purposes. Okay. So this is the next question is really just to kind of, again, hear from you. And this is a write-in question. So you'll just kind of write it into the text box. And then folks can kind of see from one another. What other areas are of interest, or people are your teams thinking about using assessment data to address? And I see that we've got some responses coming in. Elaine is saying we'd also like to evaluate response to mental health promotion activities. So that's a good one. Do we have any other thoughts, suggestions of how others are thinking about using assessment data? Okay, Marilyn just chimed in and she said we'd like to know more specifically the barriers to access mental health services. Okay, so service barriers or access barriers. And response to specific interventions that we're piloting. Oh, that's interesting. So trying to get some data, some initial data and information about new efforts. So if you're doing a new type of service or new effort or intervention, thinking about trying to collect some data to see how things are going. And John is saying also to try to attain participation from our community partners. And I think that's a big one. When we were doing the calls, we're hearing, that the partnerships on campus, are one thing. The partnerships off campus are a whole other thing. And that the extent to which those partnerships were in place, and whether there be referral systems or data sharing or just partnerships in general, that it really varied, and that the community partnerships and the partnerships back with the county offices did tend to be a bit more challenging. Okay. And then Marge also just noted how to evaluate awareness campaigns. Oh, okay. Yeah, awareness campaigns are actually kind of tricky. Those are looking at kind of the impact, how much awareness has increased over time, what awareness is before a campaign and what awareness is after a campaign. And that's also starting to get into kind of, I would say, more kind of evaluation side as well. But that makes sense as a question because some of you are looking at doing some type of awareness campaigns and building that in. Okay, so it looks like there's definitely some other thoughts or areas that folks are also hoping to collect information on or to use data for. At this point, we're going to talk a little bit more, start the nuts and bolts part, at least slightly more, in terms of thinking about determining your approach. Okay. So we talked about the why. Why would we collect data? Why would we pursue this? And then it's thinking about, okay, how? How would we do it? What would our overall approach be? If we're going to invest resources in this, where do we get the most bang for the buck? And also what's feasible for us because we have limited resources. So in terms of assessment, when you're thinking about your overall approach, your methods, I think that the initial questions for the campuses are, who will participate? We know the students are pretty much the most likely population, but then we also start to get into faculty and staff, administrators, other key stakeholders, looking at things at an organizational level or the campus-wide level. So the first thing to think about is who are we going to survey, interview, or collect information from? The second is, keep honing in on the thought about what do we need to know, what's going to be useful information for us, because that will determine the types of tools we use and how we collect the information. And then, the reality sits in, because there's probably lots of information that would be helpful, but then the reality sinks in and it comes down to how much money do we have to spend, how much human power do we actually have to achieve this, who's going to do it, and are there some unique aspects on our campus that are going to make this more or less challenging? In terms of, like, an example of that might be, if you're thinking about doing an electronic online student survey, but you have some issues around whether you can actually access student emails or whether a group email can be sent, and you're not sure whether that would actually be a feasible thing for your campus. So those are kind of all kind of front-end questions, which many of you may have already kind of wrestled with, and you may have already kind of figured these elements out, or you may still be in the process. And again, I think that there's kind of two parts to this assessment thought. One is, what do we need to do the here and now for our grant? But then also, are we in a position with this grant to be thinking about what would be helpful to have in place long term? That it's not just a one-time student survey, but that we can actually, are we positioning ourselves to be in a place that we can have something in over a more long-term basis? So in terms of who would participate, and I kind of already walked through this, the student surveys seem to be the basis of the assessment. And part of that is that it was defined within the campus-based grants, but also it's just, it makes sense that is at the foundation of a student mental health needs assessment for the campuses. But then we get into kind of the more interesting areas, I think, in terms of faculty and staff, administrators, and potentially other key stakeholders. With the faculty and staff, it ties back to their awareness, their capacity, and how to increase that over time, or how to address that. With the administrators, it seems to center around their awareness and also trying to enlist their support or buy-in for student mental health efforts. With other key stakeholders, with this built-in notion regarding the regional strategizing forums that is part of the grant, you're in this place where you are trying to kind of broaden your partnerships, broaden your stakeholder base, and does it make sense to be integrating them in some way, or their perspective in some way, in terms of this assessment process? At this point, I was going to open it up for another poll and see if folks could weigh in on, who do you plan on collecting information from? And this might be, it doesn't allow for multiple responses. You can't pick A and B. Maybe this is, who's your primary audience for collecting information? Is it primarily the students, which is my guess? How many of you are actually thinking about faculty and staff, administrators, or other key stakeholders? And it's popping in. Okay. Well, that's pretty clear response. So if folks are either primarily thinking about just, sticking with the students, or that they're only collecting information from students. And maybe we could get a little bit of maybe some text dialogue going on this one. If folks could, has anyone thought about doing some type of survey or collecting information from faculty and staff? In fact, I'm going to ask Joanne, can we do like a yes/no question? Is there a way to pop that up? Okay. Can anyone, if folks are intending or thinking about trying to collect some information from faculty and staff, if they could weigh in, because I think this is a good assessment evaluation do and don't example. My other question didn't really allow it. Okay, so there we go. We've got okay. So folks are either building it in or at least thinking about building it in. And maybe if we could think about some examples of other key stakeholders. Does anyone have any examples of whether other key stakeholders that it would be useful to get their perspective or collect information on? All right. So the first thing to be thinking about is, and actually I'm going to back this up one more time. So the first question is who's going to participate? But then the other part of that, it's kind of a two-part, is also how would they be sampled? So it's pretty easy to think, okay, we want the student perspective, and that's going to be part of it. But then the question becomes, how are we going to do this? Is it the full, the full student body? Is it a sample? And again, with the student surveys, that will be the standardized student surveys. Part of this is defined, and there are some kind of particular options embedded within it. But that does become the kind of secondary question: is who are we? What if we're thinking about trying to do a survey amongst faculty and staff? How are we going to do that? And is it all faculty and staff, and we just hope that we're going to get a decent response, or is it particular faculty and staff? So the sampling is also kind of the secondary question in that. Okay, so what are the key questions? What are things for the campus-based grants and the Student Mental Health Initiative? What are areas that would be useful information? These are kind of the generic ones. These are kind of I think, the ones that apply probably to most. And then there's probably some sub-questions that we started to actually see in the text responses below that would be more specific to your campus. But in terms of the key questions, so what are the mental health needs of students? That's kind of a bottom line one. How are these needs being met? What are the gaps in services? That's a particular of particular importance, and I think that we had someone text that in earlier to address the what are the gaps in services to address these needs? What is the current capacity of our our counselors, our student mental health team, our behavioral, our BAT or our crisis intervention team to address these needs, or the current capacity of the broader faculty and staff to actually identify needs, refer appropriately, and their comfort in terms of addressing needs with students directly as appropriate. And then what capacity building is needed to better address these needs? So how do we have this set period of time in which we have a grant that we're going to be able to try to increase capacity and sustainability in systems. What information do we need to collect to inform that, and how do we go about doing it? And in terms of special considerations for the CBGs, the assessment tools should include data, awareness of the issue, awareness of campus services, opportunities for campus building, and sustainability. Because that really is at the heart of the grant initiatives around that capacity building sustainability piece. And again, this is just a text. If there's anything else that folks thought of as I was kind of reading those, if you want to text it in, and we can kind of have that just to kind of inform the conversation as we move forward. Mm-hmm. And I'm seeing, too, that a couple folks, too, responded to other stakeholders. And There was one note around community referrals, and then also one around other service providers in town, or suggesting other service providers in town. Okay. So at this point, we're going to transition, and Al is going to kind of walk us through a little bit in terms of PIRE's cross-site evaluation role, because we're predicting that one of the questions as we're kind of talking about the assessment process for the campus-based grants is that, okay, we're planning on collecting information and moving forward, and we're assuming, that there's some assumption that the information that you're collecting locally will, meet your local needs, but then that the cross-site evaluation will also be collecting information, and that information would complement what you're collecting in some way. So we thought that as we were talking about the campus assessments, that it would also be helpful for PIRE just to kind of give you a little bit of an overview in terms of their thoughts around what they're going to be, the types of data that they're collecting, and then how this may complement what you're doing. And so, Al, I'm going to turn it over to you.
Okay, thanks. So yeah, this is really I guess, a reminder or reinforcement from some information PIRE has already given in the past about what we're doing with this cross-site evaluation. And so some of you may have heard this already. Am I correct, Carolyn, that there are a number of people who are not involved in the CBG project who are on the call?
I think it's mostly CBGs.
Okay.
Yeah.
Okay. So again, you may have heard this before. This has not really changed, but it is just, again, a reminder that as you are thinking about how to address your local needs and what your questions are, what the questions are that are important for you to try to answer locally and the methods that you're going to use, PIRE is also out there doing this complementary work. And one of our aims in doing this work is not to step on your toes or not to be totally redundant with what you're doing. So we definitely have that in mind. And I'll just go through a few slides here that'll, again, remind you of what we're working on. So if you can go to the next slide, please. So what we are doing is we're looking in particular at the CBGs, the grantees. We're also looking, though, at training and technical assistance that's being provided across the board, across all of the CCCs. And so we're not just focusing on the CBGs, but a lot of our work is focused there. And really the evaluation question, the primary evaluation question that we're asking is, what contributes to the highest prevalence of identification and referral among students in need of mental health services? So we see that as kind of the critical element that the campus-based grants are working on, is they are moving towards developing systems to be better able to identify students who have needs, students of concern, and to be able to refer those students to mental health services. And those referrals may be on-campus referrals if you have a system in place for handling those referrals, or they may be off-campus referrals. But we see that as kind of the major step forward that the campus-based grants are going to try to achieve with this initiative, and that presumably other campuses, even if they're not part of this initiative, will, if they're interested in this issue, will be trying to achieve, is how do we identify students who have needs and how do we get them services? Okay, so that's the main question. And you can go forward. And really we're collecting several different kinds of information across the CBGs, and we'll be collecting similar information from other campuses as well as points of comparison, but we'll be trying to get anyway basic descriptive data about the student populations, about the campuses themselves, to give us a good sense of what these campuses are like and what the student populations are like and the students that are served. We'll be looking at campus infrastructure related to mental health services, what kind of infrastructure exists now, what kind of infrastructure exists down the line as the CBGs move forward with their initiatives, as well as other campuses that are not part of the CBGs are presumably to some extent working on these issues as well. So we'll be looking at campus infrastructure over time. We'll be trying to track and monitor the different kinds of prevention and early intervention activities that are being implemented in all of the campuses. So really looking at what the grantees are doing to try to do things like build campus capacity and to try to reach students. And we'll be collecting some very basic outcome data, primarily at the student level, in order to understand what kind of impact these changes are having on students, as well as potentially faculty. So those are the kinds of data that we are engaged in collecting. Okay, next please. And we have a number of different sources for this information, sources that we're trying to get. So again, this one is just relevant to the CBGs. That is, you are already providing monthly invoice data to the Chancellor's office, and those invoices are pretty detailed. You're not just submitting an invoice for you to be able to draw down your funds, but you're having to answer a number of questions that were really pulled from your own work plans. And so it's very specific about what you have accomplished during the month from your work plan, the number of students or faculty members or whatever that you've reached, and what kind of capacity that is, whatever capacity that has been. So we'll be pulling that monthly invoice data. We're going to be we're in the middle of working on a set of quarterly reports that the grantees will be responsible for answering every quarter. And the first one will be January of 2013. So in January, we'll roll out this quarterly report. For your very first report, you'll be asked to provide information across the 2 previous quarters to capture the beginning of the grant. But then every quarter, so January 15th, April 15th, July 15th, and so forth, you'll be asked to fill out a quarterly report. And the quarterly report will be our way of checking in with you on a quarterly basis about how you are progressing in kind of a broad way, a general way, on the overall goals of your initiative, how your training efforts are going, what your reaction is to the training that you've been receiving and the technical assistance that you've been receiving. And we're also going to try to get through this quarterly report information about the referrals and the services that you are providing. So this will be the main way that we attempt to get referral and service information, and we'll be doing that on a quarterly basis. The last 2 are likelihoods at this moment. We're not completely sure the mechanism that we'll be using, but we will be probably administering a supplemental student survey. And the reason we say supplemental is because we know that the campus-based grantees are required to collect their own local data. We know that other campuses, other community college campuses, may be collecting data on their own because they're interested in this, and so they may collect data from a number, using one of several different surveys, which Carrie Lynn will be talking about. Our goal is, from the cross site, is to be able to get a sort of core level of consistent information across the campuses. So our goal is consistency across campuses so we can aggregate and compare that information. We know that you're already doing something or will be doing something locally, which may be a lot more detailed. And so we will very likely either working ourselves or perhaps working with RAND, the statewide evaluator, administering some kind of supplemental student survey that allows us to collect some pieces of information that you are not already collecting. So hopefully it will not completely overlap what you're doing, and hopefully it won't overlap very much at all, but it will be a set of questions that are not being captured with whichever survey you're using. And then we would also like to do something similar for a faculty survey, because one thing that we see with these projects is that the faculty are really key gatekeepers in this effort. The faculty are being trained. They may be receiving technical assistance to increase their awareness and to increase their capacity to identify and refer students. So we're interested in how that is changing over time. So those are the 2 major survey efforts that we are doing. Oh, and I missed the middle one, which is an important one, a campus mental health capacity survey. So 3 times during the grant period, starting probably in January, we will be fielding a a campus mental health capacity survey, which will try to get information from all the campuses about your basic infrastructure around the provision of mental health services. And again, you would be receiving that in January. We're going to be doing some pilot testing in December. And then I think on over the course of the next 18 months, which is when the grant ends, we will be fielding this a total of 3 different times. And that one will go to people who are whoever is most knowledgeable on your campus about mental health service provision. And you will be asked who is the person who is most knowledgeable about these issues. That person will get the survey, and that person will complete it, maybe with the help of others. But it's not a survey that's going out to the general school population. Okay, so those are the 5 main sources through which we are going to collect some information. And I do see a question, when is a supplemental student survey planned? So we are looking to do this as, I think I've said this in the past, sort of as soon as we can, because we don't want to, obviously the further we get into the program, into the grant period, the farther away we are really from a baseline. So I'm thinking that we are looking probably in the, hopefully the early spring at the latest, but I cannot guarantee that at the moment. That's what we would be targeting. Hopefully earlier if we can. Okay. Is there another slide here, Carrie Lynn? I cannot remember.
It just moves us into.
Okay. Okay, that's it. So I don't know if you want to open this to. Maybe this is a good time to ask if people want to text any other questions.
Yeah, I think before we move on to the next section, I think that if there are any questions about this, because I think because there are some potential points here where the cross-site may intersect a bit with what folks are doing locally, and I could see how the timing would play into that. But it, you know, and a point with the student survey is that there, and we're going to be talking about the student surveys next, but you know, that has already been, you know, as a campus-based grant, that's already been defined. You've already chosen that, or you know, and you probably already have your plans in place for it. But this would be something that would be conducted by PIRE and done in a supplemental way. So just to make sure that that is.
That's right. So one of these questions, for instance, which may be getting to that, I'd like to know the logistics of the supplemental student survey. Mm-hmm. And by the way, anyone who has particular questions that may take longer than my being able to answer this in this form, I think at the end or somewhere, I'm sure Carrie Lynn will give a contact number for me or for other PIRE staff members. The idea basically would be is that if possible, we, possibly in cooperation with RAND, or RAND possibly in cooperation with PIRE, would try to get a student survey going across all the campuses that wouldn't necessarily directly involve the administrators of the grants themselves. So we would hopefully be doing this maybe by getting, possibly by getting sample lists of students that we could then sample directly. An online survey would be our preference, but we may hear from some of the campuses that is not practical. So if there are campuses out there that say there's no way with our student population you could do an online survey, we'd like to hear that. But that would be the idea, is potentially we would do an online survey, and we would be able to get the sampling information that we need from a source on campus, so that it would not be the case that we would be asking you all to go do this survey for us. So I don't know if that directly answers the logistics question, but that kind of starts to get at the logistics. And I'm sure that as our plans unfold, we will be in contact with the campuses about logistical issues to make sure, again, we are taking an approach that makes sense for your campus, that is taking an approach that is not stepping on toes, that's taking an approach that is not totally duplicating something that you're already doing.
Mm-hmm. And as you were speaking out, I saw that there was another, Elaine just posted another thing, text around the timing of the Acha-Nacha survey, which they'll be doing in the spring with this idea, if RAND purchased extra questions, then to the survey, and that was decided in advance, then it could all be done at once. And we're going to actually, that's a great transition probably to our next part of the discussion, which is the student surveys. And actually talking, we're actually going to check in with campuses around timing and format. And I think that we can kind of come back to that as part of that discussion. And Al, does that work for you too?
Yeah, I think that would be great.
Okay.
Yep.
Okay. So this does transition us into the next part of the discussion, which is choosing, so we talked about, why do an assessment? What's the value? What are the key questions or pieces of information that are going to be useful? And then thinking about your overall approach. Who are you going to collect information from, and for what purposes and for what questions? And now we're going to talk a little bit more, getting a little bit more into the nuts and bolts, which is the tools. And again, this conversation, the student survey is determined for the campus-based grants. So that's in place and has already, you're moving forward with that. But again, it's just informational. We wanted to present just kind of an overview of the options, do a little comparison, and also be talking about customized tools that you can use to supplement and kind of see where you're at in that process, and thinking about where you're at locally and where PIRE's at, and what they're collecting, and then see if it makes sense from a technical assistance and training perspective, if there's any additional areas that we can provide support in to the campuses. So at this point, the first part in terms of looking at assessment tools is the standardized student surveys. And the main one is the American College Health Association National College Health Assessment, the Acha-Nacha, how it's commonly referred to. And this is the survey that's required for the CPGs, and you will be administering in the spring. And it is also, for many reasons, a survey that makes sense. It has been around for a long time. I think it's on its 12th anniversary. I think it's been around since 2000. Has quite a bit of research to support it. And a number of campuses have used it. And so there's national longitudinal data as reference, but there's also some longitudinal data now for the California Community College System with this survey. So that's, it's kind of to a certain extent, kind of the given. But there are some other commonly used student surveys that we just wanted to make sure that folks were informed about. They include the Healthy Mind Survey, and then there's also one that's out of the counseling. It's called the Counseling Center Assessment of Psychological Symptoms, or CCAPS. And it's specifically used in clinical populations. So it's not meant for the broader student base, but more specifically for those students that are actually participating in services. So at this point, I was just going to kind of quickly go through kind of compare, contrast the surveys. The Acha-Nacha it's an overall health survey. So it's actually quite long. It's got 300 questions, and the mental health portion is one section or scale within the overall survey. It is available in both paper and online, which most folks are probably aware of at this point. Each of them kind of have their nuances. I don't know if campuses are still kind of debating which way they're going to go, whether they're going to do paper and pencil or the online form. And there are, the survey does address, a number of mental health issues, including ATOD, sexual health, weight, nutrition, exercise, the mental health piece, and personal safety and violence. It's our understanding, and I'd actually be interested in hearing from folks if folks have any history of administering it, but it is supposed to take about 30 minutes to complete. I'm not sure if that actually is the case given the number of questions. So if folks are able to comment on that, I think that would be kind of interesting. And then in terms of the cost on the survey, and there'll be a number of, following this webinar, we will send out to the participants a list of the resources that supported our research when we were preparing for the webinar. And one of them is just the cost breakout sheet that's provided by the NACHA. And it lists, all the different options in terms of whether you're doing web-based surveys or paper-based surveys and the price per student. And so if you look at the web-based survey, just to kind of get a general price thought, if you're doing, let's say, 10,000 students at 0.43 per student, it's $4,300. If you've got 5,000 students, it's about $2,150. And I think in your grants, that's probably about how you were kind of estimating your costs on it. They also have these additional cost options. So, example, if you're doing the web-based survey and you want additional email reminders sent, then there's additional kind of some additional costs or fees that you can build into your process. And I'm seeing that there's a couple of questions popping up. I'm going to try to get through just the overview, and then I'm going to come back to the questions and see if I can try to answer some of them. So and then the other survey, the Healthy Minds survey, is specifically available in online form. And it's another national survey. It has been validated with general student populations. It does have some level of research to support it. It can be customized to some extent to meet specific campus needs, and it does have a particular scale or subsection for mental health. Some of the issues, mental health issues that it collects information on are stigma, social support, academic outcomes, and substance abuse. From my understanding, one of the kind of the Healthy Mind survey does try to make, with their questions, some correlation between mental health and academic outcomes. And so I think that there are some questions embedded within it that attempt to kind of look at that correlation. In terms of the cost on that survey, if you're doing a single topic, so the cost on the survey depends on which topics you're picking. The single topic survey, the mental health, would run around $2,500. And remember, again, it's an online survey, so it has a little bit less administration options. Going back to the NACHA, the other thing I wanted to note about this is that they do, in their setup with their cost, they do provide what they call, I believe, an institutional report, which is your own results. And then there's also an executive summary, which kind of is the key findings. And then they also have what they call a reference group report, which looks at your results relative to other campuses or relative to the overall sample. The Healthy Minds survey looks like it does something similar. It has an institutional report, something that might be comparable to an institutional report, and it has something that seems to be somewhat comparable to the reference group report as well. Here is, I think somebody was asking about the specific items on the surveys, and I apologize, I don't actually have that. And we were actually having a little difficulty getting a copy of the NACHA survey. directly, but hopefully this will at least start to address that question. This is a breakdown, and the PIRE group put this together. It compares, looking at kind of different scales or items, different areas. It compares those that are measured by the NACHA survey as well as compared to the Healthy Minds. And again, the NACHA survey collects a lot of good information across the board regarding health. So when you're looking at the cost on that, you're getting the whole survey. You're getting all that information in addition to the mental health. The Healthy Minds, when we looked at that cost breakdown, you can kind of go straight in and just do the mental health piece if that was something that you were interested in. But this table is nice in that it just shows you kind of the areas and just some of where the overlap is and where some of the differences are.
Carrie Lynn, it's Erica.
Yes.
I was able to pull up actually a sample of the ACHA-NACHA that's online. It looks like it's an older version, 2008 version. But just to give the participants a quick sample of one of the questions, one of them is, within the last 12 months, have you been diagnosed or treated by a professional for any of the following? And it lists anorexia, anxiety, attention deficit, bipolar disorder, bulimia, depression, insomnia, other sleep disorder, obsessive compulsive disorder, panic attacks, phobia, schizophrenia, substance abuse or addiction, other mental health conditions. So most of the questions are really formatted in have you ever been diagnosed or have you ever been treated, and then it lists out different symptoms.
Thank you. And I hope that is helpful for those that were asking for some examples. And I see that there are other questions popping up, and I don't want to neglect those, but I do want to just get through this next piece, and then we'll kind of come back. We're going to do some polling and some cross-sharing, and hopefully along the way we'll be able to address some of the other questions that have popped up. The third survey that we just wanted to kind of put out there just for informational purposes is the CCAPS. And this one is it is only for clinical settings, so it's not necessarily appropriate for your full student population. It's really more for those that are part of are participating in services. And there's two versions of this. There's a 62-item and a 34-item instrument, and it's specific to mental health. And you can see kind of the scales that are embedded within the 62-item versus the 34, kind of where the differences are. On this survey, you can access it for free, and they do have some kind of sampling data on it, or there is some research that has been done on it, and you can look at your data relative to other populations that have been surveyed. But with this survey, you're obviously lacking any of the overall support structure that's in place with the other two surveys in terms of generating reports. You're kind of on your own in terms of scoring. You're kind of they have some, I think, software to support it, but you're assuming some additional responsibilities with this one. So at this point, we're going to come back and just do some polling questions just to see where folks are at with the ACHA-NACHA and in terms of their kind of their planning around it. And so in terms of the if folks know whether if they've chosen the online or the paper version to administer, we'd be interested in knowing that. And I think that might also be some good information for PIRE as well. And so maybe A is if you know that you're going to administer the online, B is if you know that you're going to administer the paper pencil, and C is if you don't know, you haven't picked yet. If we could have folks weigh in on that. Okay. So we've got, I think folks are still thinking about that. So so far, it looks like, so Al, I think this is helpful. It looks like most are going with online.
Yeah, that's good to know.
Yes. And, okay. And then the next part, and I think that, part of this is determined a bit by kind of the method that you're doing, and then also kind of what you're paying for in terms of with the developers. But the question here is whether you're intending to survey a sample of your students, a portion of them, or if you're actually trying to go the whole to survey all students. So maybe A is that you know that you're going to do a sample. B is that you know that you're going to try to survey all students. And C is that you don't know yet, or you're still figuring it out. Okay. This is also helpful. So it looks like that there's kind of a split on this, and that this is an area that some folks are still kind of trying to figure out in terms of how they're going to approach it. And it also may, again, go back to whether you're doing the electronic or the paper pencil. Okay. And then this one, I think it's spring 2013. But if there's any kind of nuances to that, maybe we could do. Maybe we could turn this into a poll, and A is if you're doing spring 2013, or B is if you're doing something else. So, and Al, I'm hoping too that this is good sharing, hopefully across the campuses, so you can kind of see what others are doing, but also that it's good information for the cross-site evaluators just in terms of planning process as well.
Right. I'm wondering if I could even ask, and if we could put another poll up, among those who are choosing to do a different time. Okay. So not the spring of 2013. You answered some other time. Could we have a poll that A is before then, before the spring of 2013, and B is after the spring of 2013? I'm wondering if there's anyone who's kind of ready to go soon. Okay, so if I remember the way I asked the question, so most of those who are not going to do it in the spring are thinking of doing it after the spring. Mm-hmm. Okay, thank you.
So in terms of implementing the survey, this is where, we can kind of give some kind of general tips, but also for those that have actually implemented the ACHA-NACHA, which I think we have a number of folks, a number of campuses on the line, or at least a few that have done that. Some sharing where we even open up the line to do a little sharing on this, I think it would be helpful for those that are going to be newer to the administration. But in terms of implementation tips, obviously, depending on how you're approaching it, you want to ensure that you're approaching the sampling correctly, or that the survey is accessible to all. And so if you're doing it electronically, which it seems like more campuses are tending to do, you do get into on some campuses, depending on your email access and whether you can actually directly send the survey developers all of your student emails, or whether you have to house that on site and then do the distribution yourself. There are some nuances there in terms of accessibility, in terms of confidentiality, and in terms of how the survey will be administered. There are also some tips that the developers do have some tips on also making sure that disabled students will be able to participate, whether it be via paper pencil or electronically. And then there probably are some language options as well that your campus may need to look into with the developer if that is applicable for you. So the privacy concerns are something that needs to be thought about in your planning process. And the developer, again, they have a number of, if you look at their guidebook or their administration tips, they do offer a number of suggestions around this. But it is something that you want to be thinking about in advance. And then, there have been, it has been shown that obviously incentives will help. There are, you might do something like that, tie it to all those that participate to the end of the survey and a final survey is submitted, that they potentially are able to be eligible to receive some incentive. But again, the incentives, if you're going to approach that, thinking about it relative to the privacy piece is also important. And then again, in terms of the online surveys, thinking about whose email will appear in the email invite and how it's distributed. The accessibility locations for online completion is definitely a consideration. And also, how you're potentially advertising the survey and enlisting your faculty and staff in that process. So at this point, do we, it looked like, Elaine, I might actually put you on the spot, or somebody actually commented earlier that the administration time took about 45 minutes. I'm wondering if anybody is willing to just unmute themselves that might be able to share a little bit in terms of their experiences in terms of administering, if we have any folks that be willing to do that. And *6 is the unmute.
Hi, this is Elaine. We've done it twice on our campus, and our researcher does a random selection of classrooms, and we actually go to the classrooms to do the survey. So one of the things that's really important if you're going to do that is to do it early in the semester, because the instructor is, sacrificing a whole class period basically.
Sure.
And if you're close to the end, they're less likely to want to do that because they have, make up lost time and stuff towards the end of the semester. And you also lose students as the semester goes on. So we've done it in March. This time, if I can pull it off, I'd like to do it in February because I think it would be easier on everyone. But it's a huge commitment for the campus because for our campus, we need 800 completed surveys to get a really significant result. And so that's a huge number of class sections that are participating in the survey because our average class size is, around 30 or 35 usually. So, we trained research assistants to help us administer the survey. We did our consent with a letter that explains the survey, why we're doing it, and by completing the survey, they consent to do it. But they get that letter, and we just read it to them at the beginning, so everybody is presenting the survey exactly the same, and then we have a sealed box that they put it in as they leave the room. And we be sure and give them information about student health services, so if the survey created any anxieties or brought up any issues they wanted to deal with, they had resources available to them to deal with it. And we did a pilot on our campus back in 2005, before the first time, just to make sure it wasn't going to be place our students at risk or anything, because we have a pretty conservative campus in a lot of ways, and the response to the survey was really good and positive. So what else? So we keep all the completed surveys locked in a file cabinet during the survey process, and then they're all mailed in together to get scanned by the ACHA, NCHA.
Do you remember about how long it took to get your reports back? What the time frame on that is? From the time that you administer to the time that you get? Because that might be I'm thinking that others might be kind of curious about that as well.
Well, we got them before the end of school in the spring, so we finished it in March. So I think we got them probably in May. So about a month and a half, something like that. And I think sometimes they wait on that because they wait till they have the national report
or that reference group report. Sure.
Yeah. So a lot of times they send them together. And there is a question in the demographic data on the NCHA about what their self-reported, what their average grade point average is. So you do have one reference that you can kind of then, if you want to do further analysis yourself, you could go back and look at everybody that was depressed. We did that. Everyone that indicated they had depression as a diagnosis, then we also compared their grade point average with everybody who didn't indicate depression, and
that's nice.
So their grade point average was significantly lower for the depressed students. We didn't find that for anxiety or sleep issues.
But the data, you were able to do those comparisons, and those are nice examples of different ways that the other campuses might be interested in kind of looking at their own results.
Yeah, so those we had to customize, our own analysis for that part because NCHA doesn't do that. But anyway, it's been a really useful tool for us. We've done it twice, and you get really valuable information. So it's worth the effort.
Thank you for sharing. I'm sure that was helpful for others to hear in terms of just for those campuses that don't have the history of doing it. It's really nice to hear some really kind of specifics from somebody that has a history of implementing it. And we're thinking that as as we get a bit closer, that in terms of the TA and training, that we may actually invite the developers to do a webinar so that they could, talk with the campuses collectively, and then also invite campuses that have a history of implementing it to join and be able to share a little bit more about more specific implementation strategies. So, Elaine, thank you.
I was going to just add one thing. Somebody asked about incentives. We didn't have a budget for incentives, so we didn't offer incentives, but part of what we tell them when they do the survey is that this is our opportunity to let us know what the actual needs are on campus so we can develop programs to meet their unique needs, and just really emphasize how important and valuable their input is. And we had very few people who elected not to do the survey. So
okay. No, thank
you. That was their incentive.
That sounds like a pretty good one. Okay, you got a thank you from Melissa. So at this point, I just want to acknowledge a couple other comments that popped up, and then we're going to move to our next part of the discussion, and I'm going to turn it over to Erica. And we are running tight on time, so I will need to wrap the discussion portion up. But I think it is helpful to hear from one another, and I think that puts a little bit more, kind of helps, give you some specific ideas of how you might apply it for your campus. Somebody had asked specifically, can we skip the NACHA and substitute the Healthy Minds? And also, we have a representative, Colleen Ammerman. So, Randy, I'm not in a position to be able to comment on, whether you could do that or not. But it looks like Colleen Ammerman from the foundation responded, and she noted that they're currently working on having discussions regarding the survey, and that they will be providing additional information to the campus-based grants. So I just wanted to note.
Hi, Carrie Lynn. This is Colleen. Can you hear me?
Yes, I can, and they
I
can
just
too.
wanted to say that the Hacha-Nacha is a required survey for all the CBGs. And
Okay.
we're working with the Health Association to determine the exact parameters of what is required. We don't have an answer to that in this moment, but it is a required survey. Participation in the survey is required for the Hacha-Nacha.
Okay. Well, thank you for clarifying. That's helpful. Thank you. So at this point, I'm going to turn it over to Erica, and we're going to kind of move the discussion beyond and start to talk about some other pieces of information that can complement your student survey.
Great. Thank you, Carrie Lynn. So along with the Hacha-Nacha, which is the required survey, there are some additional assessment options that you can consider to utilize on your campus. Some of you may have already done this, but there's definitely a great way to kind of dig deeper into the student surveys using different methods. And those methods are customized surveys, focus groups, interviews, and tracking tools you may currently already be using. So to move ahead to customized surveys, although many of you did note that you primarily wanted to focus on evaluating the needs of students on campus, customized surveys can also be developed to really assess needs of faculty and staff. So I know that several during some of the calls with the campus-based grantees as well as other college campuses and the community college district did note that training the frontline faculty and staff that really have a direct relationship with students, ongoing and more of a one-on-one connection with students as they may see them more often, that training and services for those faculty and staff are really important to help support student mental health needs on campus. So a customized survey can be developed and used to really determine the awareness of mental health, student mental health issues on campus, and as well as awareness of services that through mental health services are provided to students. It can also really assist with determining the current capacity of faculty and staff, whether or not they're in a position to participate in student mental health issues on campus, a role they may like to play in assisting with providing services or referrals for students, and then also to help determine for your knowledge areas for capacity building and providing training opportunities for those faculty and staff. So these customized surveys can be done really to get a deeper understanding of the needs for faculty and staff, and that can actually be an area for customized training and technical assistance through CARS as well, if this is something that you're interested in learning more about. Next would be
Erica. The one thing I would just add to that, just so that, so in some of the cases, for some campuses that were looking at doing customized tools, they were, the timing, they were kind of trying to go out the gate pretty quickly, and we've been able to work with a couple campuses in helping them, develop items or assist in the process, whether it be a survey or a focus group. But other campuses, we may have missed the boat a little bit in terms of timing, and we apologize if that was the case for any of your campuses. But the other factor here too is that PIRE is also looking at doing a faculty and staff survey potentially, and so that also is just kind of in the mix in terms of potentially kind of just planning around. So it's just another consideration as we're all moving forward. Okay,
great.
Sorry.
Thank you, Carrie Lynn. No, thank you. Another area to look at as we're moving forward with developing relationships and partnerships on and off campus, as Carrie Lynn mentioned previously, there are other surveys that are currently being implemented potentially on campus and off campus, where you can grab a hold of the data analysis and see what some of the other needs are in the community on campus and off campus. Carrie Lynn mentioned earlier working with partners and how that can sometimes be a challenge, but for the most part, there are partners on and off campus that would be willing to share their data analysis, as well as potentially in the future maybe involve campus and your student population in that assessment for future surveys. So looking at other department surveys that are happening on campus, perhaps there's the school safety department is doing surveys to assess student safety. That might be a great way to supplement the information from the student needs assessment that's gathered from the ACHA-NACHA, just to provide you with a more in-depth picture of the student issues and how they relate to mental health on campuses. Also collaborating or connecting with your county mental health, which I know is an area many of the campuses are really interested in creating a stronger relationship if they don't currently exist, even though that may be an area of challenge. But many of the county mental health departments really commission different surveys that relate to county mental health needs, especially around Medicaid. There were several that in doing research I was able to pull for Sacramento County and other counties that implement these countywide surveys to really assess what the mental health needs are throughout the county. Other areas that you may want to think about collaborating on are hospital data. And in many of your communities, I know many of you know or refer to hospitals for their mental health services, but also there are data that the hospitals collect as well in relation to who they see in the hospital, but also what some of the needs are in their community. As an example, in Sacramento County, every 3 years, 4 large health providers that include Kaiser, California Healthcare West, Sutter Health, and UC Davis, they actually implement a countywide community health needs assessment in collaboration with a local research evaluator. So they're able to pull quite a plethora of data that can speak to the mental health needs. So it includes physical health, mental health, so it really covers the gamut of community health needs. And so accessing that report and then potentially creating a collaboration with those hospitals can be an area for future reference as well. And then also CSUs and UCs and their data collection points as well. Many of the sites implement also student engagement surveys, which also can help supplement information that you're collecting on your own campus around student mental health needs. So quickly, I know we're running out of time here, but moving on to the next option is using qualitative methods to really drill down and focus some of the information that you're seeing that come out of your student needs assessment results. Those two are focus groups and interviews. Focus groups are really useful for really drilling down and getting the perspective of student populations on campus. An example of this is West Valley College. They actually used a customized survey specifically focusing on veterans and their needs of reentry and reintegration back into community life. And through that customized survey, they decided that they wanted to implement a focus group, which CARS assisted them in creating focus group questions to really assess what those needs are from the veterans on campus. So it's a great way to open up dialogue and have a really comprehensive dialogue and ask questions through the focus group method to be able to supplement maybe some of the issues that come up that you see in your needs assessment. Another option is implementing interviews. They're done in an intimate setting. They definitely are an opportunity to ask very specific questions, maybe of faculty and staff, of their training or support needs or how they might want to be integrated into student mental health needs on campus. So focus groups and interviews really can be the opportunity for you to really dig down and dig down and gather a lot of information about very specific topics or give people an opportunity to just talk and listen to other issues that may come up. So lastly, so again, as I mentioned, you want to really use these methods to supplement quantitative data from other surveys. and be able to assess what existing resources and services, the impact of those, and where there might be some gaps, as Carolyn mentioned in the beginning of the webinar, where there might be some gaps in resources that we can provide and services on campus. So the last item that we really wanted to talk about is the referral and intake form. So many of you are already using referral and intake forms, and they can be used to track the ongoing student needs on campus. So as students are coming in to see you or being referred for mental health services, you get a really specific up-close and personal understanding of what issues the students are dealing with, what they're referring for, and what services they're really interested in receiving. It's also an opportunity to point to potentially unique campus issues. Is there issues around homelessness? One of the campuses was able to do an evaluation and get great data on the issue of homelessness and gun violence, which was a major concern for students on campus. So those could be unique campus issues that would be able to be tracked through referral and intake forms. And then another area will be really highlighting areas for program planning and implementation, as Carolyn mentioned in the beginning as well. Are there areas that are missing? Are there areas for support? If homelessness is an issue on campus, are there outside resources or ways that you can collaborate with services off campus and on campus that would be able to support those issues? So those, using your existing forms and looking at them in a different light for evaluation and needs assessment can really help increase your ability to look a little bit, look at specific issues that are on campus. And I know we have a question here if there are any real-life examples to share, but I know we're towards the end of our time, so I want to go ahead and turn it over to Carrie Lynn.
Yeah, and I just want to also acknowledge that we are at time, and I know that probably a number of people will need to pop off. The last part, we did want to make the session interactive, so I hope that was helpful for those participants to be able to kind of share a little bit with one another and just start to develop a frame of reference for what the other campuses are doing. The last thing that we were going to just make sure was thought about was if you're going to take the time to use the findings or to collect the information, thinking about how to use the findings, and thinking about that on the front end. I think that's the important point, is to think about not only what you want to collect, what information you want to collect, but at the end of the day, what do you want to do with the data? Who is it going to? How are you using it to build capacity, to increase awareness, to advocate for support, and to be thinking about that on the front end as you're approaching your assessment. And we did have a number of, in this section I was mostly going to be referring back to some examples and some references. One in particular is out of Cornell University, where they have some kind of nice examples around what they did with data and how they directed it into some resources. And so as a follow-up, the participants on this webinar, and we'll also post it to our website, but we have a list of resources that did not go out in advance of the webinar but will be sent to you as a follow-up. And so the Cornell one is one resource, and we have a list of other hopefully relevant resources for you as well. At this point, I just also wanted to tie it back to, this webinar is kind of one step to support you in your student mental health efforts, whether you be a campus-based grant or part of the broader CCC system. And we are going to be doing a number of webinars. We're rolling out a number of regional trainings, and ongoing individual consultation is available to you. So if you're not in the loop on that, we hope that you will be in the loop on that. And if you do have a particular need, something that's kind of more immediate, just give us a call, and we can try to meet that need and work with you. Also, I did want to note that we do have a couple of upcoming webinars and trainings that'll be available to you. But in December, there are two in particular. On December 3rd, there's a training, another webinar on how to establish and maintain an Active Minds chapter on your campus. We did this webinar, I think, yesterday, on the 27th, and we're doing a repeat performance with Active Minds on December 3rd, and that'll be from 10:30 to 12, I believe. And then on December 4th, I believe, we're doing just another informational webinar just to inform campuses around the TA and training services. Most of you probably have already participated in that. We're trying to outreach to some of the campuses that we may not have quite been in contact with yet. And then on, Joanne, and you can correct me, but I think on December 14th, it's either December 14th or 15th, I think Joanne will write it in, and it'll also be posted to our website, and you should be hopefully receiving our electronic marketing announcements. But we're doing another threat assessment regional training with Palomar at Palomar College. It's a full-day training. It's happening on December 14th. And we're also, we did, the first one was at Santa Rosa Junior College in November, and we're looking at rolling out at least another 2 to 3 of these trainings. We're also looking at doing soon, hopefully, looking at doing a informational webinar for campuses that would be interested in hosting the Welcome Home training, which is geared towards building capacity to support student veterans specifically. And we're excited about that and looking at rolling that out. Probably we're hoping to schedule those trainings probably in January and February. And if you are a campus-based grant, we're also looking at bringing people together, and I believe you received a letter in April. And so that event is also on the horizon. Again, please feel free to contact the CARS office if you need immediate assistance or long-term assistance, and there's our information. And I think that is a wrap. Joanne, do you want to tie them back to the evaluation form?
The evaluation form, actually, when you log out of the webinar, it should automatically pull up on your screen. So if you wouldn't mind filling that out for us. And I'm looking for the link to register for the threat assessment that I'll post on the chat area also for you.
Okay. Oh, I see some questions popped up, too, in terms of the accessing it. Okay. Okay. As folks are on the line, just, in terms of, for those that are still with us, just as a reminder, too, that CARS is partnering with Cognito in terms of providing the overall technical assistance and training services, and Cognito is offering the online training. And you can access these the broader umbrella of services as well as the Cognito online trainings by first submitting a technical assistance form. And then we're asking campuses, and I think most of the campuses on the call or the webinar have already undergone this, but we ask that we do a 1-hour initial consultation and readiness call with each campus, and as a result, we try to create a technical assistance plan for your campus. And as part of that, we talk about the technical assistance and training services, and more specifically, the Cognito online training services as well. So if you haven't had your 1-hour consultation call, we'd love to do that. Our goal is to do that with all 112 campuses. So if you have not done that, please give us a call or just send us an email, and we'd love to follow up with you. At this point, I think most people have dropped off. And do we have any last questions? Okay. All right. Thank you everyone for your time, and I hope that the information was of value.